studying about lifestyle diseases. And in previous class I told you what is a lifestyle disease. Lifestyle disease is a disease that is coming or developing as a result of our mode of lifestyle. And we have also seen some of the common lifestyle diseases like Alzheimer's disease, then arteriosclerosis, cancer, heart disease, then chronic obstructive pulmonary disease, and finally. So up to that we have studied, and today we will study two or more diseases. One is nephritis. Nephritis is a kidney disease. Nephron is actually the most basic functional unit of kidney is known as a nephron. So here the kidney or the small nephrons inside the kidney are primarily affected. Now here what is happening is that there will be blood in the urine, blood content in the urine, and amount of protein present in the urine will be increasing. Presence of pus cells will be there in the urine, and there will be inflammation on the legs. Some people will be having difficulty in urination, and there will be back pain. So these are some of the common characteristics of this disease known by the name nephritis. And this is also a very dangerous disease because it can lead to kidney failure. Because as you know, this kidney failure and other things are only very slowly observed. We do not have any advance warning. Unless we are checking the kidney regularly, most people will not be getting any advance information about the damage that has been occurred to kidney. So that is why most of the time the kidney failure are usually dictated at a very later stage, and only possibility then is to go for continuous dialysis or for a kidney replacement. These are the two only present treatment option as in the case of this kidney failure. Now here you can see that hypertension simply means high blood pressure. That is the most important cause of kidney failure, because what happens is that kidneys are consist of very fine, very small tubules known by the name nephrons. These nephrons, because of higher blood pressure, they may get damaged. So you might have studied about this nephron in your high school or plus 2 classes. So because of higher blood pressure, these small blood tubules will be getting damaged, and the kidney may not be able to function properly. So that is what is happening in the case of nephritis. There is damage to nephron, and that will be resulting in the failure, or that kidney may not be able to do its normal function. So that situation is known as a kidney failure. Now here you can see that what is happening in the case of this is a normal kidney, and what happens in the case of a glomerulonephritis. This portion will be completely damaged, and as a result that area may not be, because the primary function of kidney is to produce urine or remove waste material from our blood and other body fluids and expel it in the form of a urine. And that urine will be mainly containing ammonia and urea. So if the urine formation is not taking place, what will happen? Ammonia as well as urea will be present in our blood, and they will be accumulating in our blood, and that will be ammonia and urea are poisonous substance, and that will be leading to damage to almost all the organs of the body. So this is what is happening in the case of a glomerulonephritis. Now another situation is known by the name stroke. Now in case of a stroke, actually you might have heard about this term stroke many times. Stroke is actually here you can see that most of the time what is happening is that this is how the stroke is usually taking place. See here you can see that. So stroke is a disease or disorder happening to the brain. What is happening is that there will be a block in some blood vessel which are going to the brain, and because of that block inside the blood vessel supplying the brain, certain part of the brain may not be able to get blood. So there is no blood supply to that part of the blood brain. And what happened? Brain cells here will be not getting oxygen, nutrients, and they will die. That situation is what we call by the name stroke. So stroke is mainly death of brain cell because of lack of blood supply. So that is what is known as a stroke. So most important reason for the presence of stroke is due to the formation of clot. A blood clot occurring, either a blood clot or because of the presence of this kind of fat deposition. Cholesterol particle will be blocking this part. And as a result, there is no more supply of blood to the important areas of brain. One important problem with the brain cell is that they cannot survive more than 10 minutes. So after 10 minutes, if your brain cells are not getting any oxygen or nutrients, they will die, and they may die permanently. So, but sometimes our brain has a capacity of regenerating some of the cell. That is why some people having stroke, and doctors will say that their entire left side has been paralyzed. But after 3 months or 6 months, and we can see that some of these patients completely recover, because our brain cell has a capacity of regenerating partially. In case of some people, they will regenerate completely. So if depending on the age of the person, if it is 50 plus, then it is okay. But if it is 80 plus, the chance of recovery is very slow and sometimes impossible in the use of a stroke people. So this is what is known as a stroke, and here this is also a stroke. Here what is happening is that because of higher blood pressure, some small blood vessels here will rupture. They will break and releasing all the blood into this area. So what happens is that there is a blood flow inside the brain tissue, and that is known as a hemorrhagic stroke. So these are two different categories of stroke. So in both cases, stroke is usually linked to higher blood pressure, then any kind of circulatory problems, then cigarette smoking is an important reason for stroke, then heart disorders, embolism, some kind of this kind of situation is known as embolism. Then family history of stroke, if the parents or grandparents are having a history of stroke, there is every possibility that you can also have a stroke. So all these are some of the important. Then birth control pills. Every medicine that you are taking are having some kind of side effects. There is no medicine, whether it is allopathy or it is Ayurvedam or it is, every medicine has some kind of problem. Sometimes some may not be very prominent or may not be very visible. Only at a later stage we will come to know that all these drugs are creating some kind of mild problem. Then the most common reason is the amount of high cholesterol. High cholesterol will be leading to a situation like this, and there will be fat accumulation, and that will be leading to this problem. So this is known as a stroke. Here also you can see that how blocking in the artery or the fat deposition can lead to this lack of blood supply to certain regions of the brain, and this is normally what we call by the name stroke. Then another kind of disease is known by the name diabetes. About diabetes, you might have heard, because everybody know what is a diabetes. Diabetes is a very common disease, especially in India. And what happens in the case of diabetes is that our body slowly loses the ability for converting glucose into the glycogen. So in our body, when we are taking some kind of glucose or any sugar, finally that will be converted into glucose. And that glucose is the main nutrient which is used by our body for giving us energy for various activities. So what happens normally is that if there is any extra glucose in your blood, that extra glucose will be converted into a form of fat known by the name glycogen. Now, in a diabetic patient, what happens is that this conversion of extra glucose into glycogen that may not be taking place properly. And for that, we need a hormone known by the name insulin. So, insulin is a hormone that stimulates the conversion of extra glucose into glycogen. And when this conversion is not taking place, what happens is that extra glucose will be present in the blood in the bloodstream itself. So the amount of blood normally present in the blood vessels will be increasing. At the same time, our cells as well as tissues, various tissues, they may not be getting sufficient quantity of this glucose. So what happens is that your cells are living in a pool of glucose which are rich in glucose, but they are not able to take this glucose into its cytoplasm. So that the cells will be starving, at the same time there is plenty of glucose available. That is the situation what is happening in the case of diabetes. Now here there are 4 different categories of diabetes, and the type 2 category is the most common type of diabetes, and this is we call as non-insulin dependent diabetes or adult onset diabetes or ketosis resistant, different type or stable diabetes. Because in the case of type 2 diabetes, it is developing in an adult patient, most commonly after the age of 40 or 50. Most of the people may be having this kind of diabetes. So it is it is a non-insulin dependent type or diabetes. Now the first category is known as a juvenile diabetes. Now, in the case of juvenile diabetes, what happens is that they will be occurring in very young children. What happens is their body may not be producing insulin. So, what happens is that this conversion of glucose into glycogen may not be taking place because of the lack of insulin. So, only treatment available for them to take a daily dose of insulin. That is the only possibility. So this happens from the very early age in birth. So that is known as a type 1 diabetes. The most common type is known as a type 2 diabetes. Then type 3 is a kind of known by the name gestational diabetes. That is normally developing in women during the time of pregnancy. And pregnancy is creating a lot of metabolic stress, and as a result of this metabolic stress, some women, not all women, may have a kind of diagnosis known by the name pregnancy related diabetes, otherwise known by the name gestational diabetes. But normally this diabetes will be over after the delivery, so there will not be much problem. But in few women, if there is a gestational diabetes, that means that will increase the risk for developing this kind of type 2 diabetes later in their life. So gestational diabetes is a kind of warning signal that your body may not be able to handle this lot of glucose stress. So that means if you ever had a gestational diabetes, you should be very careful that you are actually in the prone category. You have a higher chance of developing other form of diabetes later. Then type 4 diabetes include other type of diabetes linked to diseases of pancreas or hormonal changes or side effects of drug. All these are coming under the type 4 category. So these are the 4 prominent type of diabetes. Now here also you can see what are the common symptoms of diabetes. Some of the symptoms you know already. There will be more frequent urination. There is extreme hunger. The people will be having more hunger. The reason is that, as I told you, the cells are not able to take this glucose from the bloodstream into its cytoplasm. So there is glucose in our body, but cells are unable to take that glucose into its cytoplasm, and they will be starving. So that is known as that will be resulting extreme hunger. Then sudden loss of weight loss. The person may be having a sudden loss of weight. Then presence of ketones in the urine. That is also an important situation. Ketones are actually a kind of byproduct of muscle. When muscles the fat in the muscles are actually utilized for glucose formation, there will be a byproduct known by the name ketone bodies or ketoacetic acid, acetoacetic acid, etc. These kind of substances are known by the name ketone bodies. They have the smell of an acetone. That is why they are not. So sometimes acetone, the nail polish remover, that is the acetone. When the urine is having the smell of a nail polish remover, it is a sign that there you have ketone bodies in your urine. Normally that happens during some kind of problems associated with your glucose metabolism. Then high amount of fatigue, the vision. Some you might have heard about diabetic retinopathy. High diabetes can damage your retina cells, and that will be leading to a type of eye disease known as diabetic retinopathy. Then the healing of sores, the any sore or injury on your leg or feet, they may take sometimes weeks or months for healing. Sometimes some people maybe have to cut their feet to prevent the muscles from expanding. Then mild high blood pressure will be common. Then gum infection, vaginal infection, urinary bladder infection, all these. So actually diabetes is a very troublesome disease. It can affect almost entire system. There is not even a single system. Almost every system, circulatory system, reproductive system, respiratory system, every system in your body will be affected by this diabetes. That is why maintaining diabetes, keeping diabetes under check is very important for a long healthy life. So this we have already seen. So now we will see what are some of the major risk factors in diabetes. Some of that we will take from here. So in the use of risk factors in diabetes, so in the use of diabetes, here not diabetes, in the use of lifestyle diseases, these are some of the most common type of risk factors. One is diet itself is a major reason. Because if you eat a lot of cholesterol, fat-rich food, that will be containing high amount of fat or cholesterol that will be accumulating and slowly leading to the increase in cholesterol content. So that is the problem. Poor diet is a major reason, especially in Kerala and most of the parts of India. Our food is mainly rice and or wheat. Both are actually carbohydrate. So that is why in India there is a high the incidence of diabetes. But if you go to even in USA, they eat a lot of food, but they have their diabetes is not as much as in the case of Indians. Indians have one of the highest rate of diabetes in the world. The main reason is that we eat a lot of carbohydrate. Our rice and wheat are primarily carbohydrate. So one way by which you can reduce carbohydrate is that reduce the intake of rice, reduce the intake of wheat. So so instead of carbohydrate, you can go for more amount of fruits, vegetable, or even more. For example, eating 1 or 2 eggs every day. That is a good way of reducing dependence on carb, because along with the breakfast you can take 1 egg. That is absolutely fine, and it is also good for your body, because when you are taking 1 egg, you may be able to reduce your intake of carbohydrate. So what you can do is that if you are eating, you can reduce 1/3 of your normal breakfast, and instead of that you take 1 egg. And at your age, you can take 1 egg in the morning and 1 egg in the evening. The egg is actually protein. So if you follow this habit for 1 month, you may be able to notice one thing, that if you are eating 4 or 5 idlis, by around 11:30 you may be feeling hungry. But if you take 1 egg in the morning, even if you take less idli or less amount of food or other breakfast stuff, you won't feel hungry. because eggs are a slow releasing energy thing. They will not be releasing energy very quickly. They will be slowly releasing the energy. That is the advantage of taking more amount of protein. And another way by which you can reduce is that taking 1 glass of milk every day before the sleep. So that also is a good habit for reducing your dependence on carbohydrate. So both of these this kind of habit you should follow throughout your, whether even till a old age you can have 1 egg and 1 glass of milk every day. Then physical inactivity. Most of the time what is happening nowadays is that your generation is almost entirely dependent on this mobile, computer, etc. You have developed in a born in an age where there is internet. Internet was the peak. So there is internet. You cannot even think of a world where there is no internet. So but and because of that, you are spending a lot of time with the mobile, computer, etc. And most of the time when you are working with a computer, you are simply sitting, and that will be leading to a situation in which you are not getting enough exercise. Nowadays you can see that a lot of people are going for gym. Actually, it is an unnecessary thing. Some behavioral changes are only needed. As I told you in one class, man is designed to as an animal to walk, run, and jump. So we should have some kind of walking, some amount of running, or some jumping or swimming, etc. That should be our part of our daily natural life. But when this is not happening, we need to go for artificial way, and that is what is happening. If you go for a gym, they will make money, and your body may or may not be getting much benefit. So instead of going for such kind of activity, what you can do is that spend some time in some kind of physical activity. Even normal cooking, cleaning your house, everything is very important. So and nowadays you people may be very much interested in going abroad. One thing you must always remember is, if you want to go to any foreign country, whether even if you are in a highly paid job, you should know the basic cooking. Because if you are going to stay there in a hostel, most of the time they will have 2 3 rooms, and it will be like a small apartment like setup, and there will be kitchen, and you will be responsible for cleaning this kitchen, cleaning your toilet, cleaning your room. And most of the time, even in a hostel, there will be a daily cleaning schedule. This day the cleaning should be done by this person, and if you are not doing the cleaning, they will charge you $100 or $200. So that will be a big amount. So this is how situations are there in most of the developed countries. But here there is no such. Even if you are staying in a hostel, you don't need to clean. It's not your responsibility. But if you go abroad, that will be your responsibility. Another thing is, if you don't know any cooking, you will suffer. So at this age, if you have any plan of going abroad, learn some basic cooking, do some household cleaning. Otherwise, when you go abroad, these things become your heavy responsibility, and if you do not clean, you will have to pay a lot of money. Then smoking, or obesity and overweight. Controlling these two is very important, because most of our food are rich in carbohydrate and cholesterol. So unless you take a special precaution for preventing overweight, your body will grow in weight. The weight of your body will gradually increase. Then smoking is also an important feature. Nowadays, many young people are smoking any kind of smoking. It is actually injurious to your health. It will be damaging your lungs, and you can see a lot of problems are associated with the smoking. And people are also taking a lot of alcohol. Alcohol, the problem is that alcohol can lead to liver disease, high blood pressure, high then heart diseases, etc. So, or then alcohol can also lead to increase in body weight and in development of obesity. So these are some of the problems of excessive alcohol consumption. Then another case is mental stress. Handling mental stress is something everybody should develop because life is always full of challenges. There is some kind of even if you are a very rich person, and still there will be some kind of challenges. So everybody will be. Some people may be having financial challenges. Some people will be having stress due to family relationship. Some people may be having stress to official relation or official colleagues in your office. Then some may be having trouble due to neighbors. So some kind of stress is part of your daily life. Handling stress is an important thing. If you don't know how to handle stress, that can lead to anxiety, that can lead to depression, and all this anxiety and depression can gradually raise your blood pressure, and that will be affecting your immune system also. So when you are stressed, you are prone to many diseases. So when you have a lot of tension, you might have sometimes noticed that some students during the time of examination, they may get some kind of diarrhea, examination induced diarrhea. So that tension, sometimes some people call tension diarrhea, because tension reduce your working of immune system, and you become more prone for development of many illness which are not normally affecting you. So it is important that how to handle mental stress, tension, and that should be just like maintaining your physical body in good health. Maintaining your mind also in good health should be a priority. Unless you take care of your mind, you will get into this kind of tension and depression. Then another problem is sleep deprivation. On an average, every person should have, at your age, you should have 7 hours of sleep. And if you are not sleeping 7 hours, that will be having a effect on your brain and effect on your body. So always make sure that you are sleeping at least 11:30 and get up by 6:30. And if you are not doing that, that will be slowly having an effect on your body. Your physical health will be affected, your mental health will be affected, because brain needs a lot of rest. Now normally what is happening you during the rest is that when brain is completely having the proper rest, it can work more faster. So that is the basic principle of sleep. Sleep is the time during which your brain cells are actually regenerating and recovering. They will be overcoming their fatigue. So if you don't know, give the brain cells that time, there will not be any proper recovery or regeneration for the brain cell. That is a problem, and your thinking can be affected. So always make sure that you sleep 7 hours. At your age, 7 hours of sleep is actually necessary. Then genetics, some people may be, their parents may be very fat, so they may have a history of developing many diseases like heart disease, diabetes. A family history can increase the likelihood of many of developing most of the lifestyle diseases. Then environmental factors like exposure to pollutants, toxic chemicals, poor living condition, all these can affect your chance of developing lifestyle disease. Then social determinants of health. You can always see that lower income individuals may have limited access to healthy food and health care and exercise, because one important thing that we can be proud of our state is that in Kerala, if you have some kind of health issues, we can immediately go to a doctor or hospital. But if you go to any developed country, Europe or America or Canada or Australia, New Zealand, etc., if you want to visit a doctor, that will be a big challenge. Most of the time, to getting the appointment itself may take sometimes 1 month or 2 months, especially with regard to specialist doctor like a gastroenterologist, cardiologist. You may need to wait for 2 3 months to get the appointment. But in our state, if you want to visit a cardiologist, you can go to the hospital, and by evening you can definitely see the doctor. So that is one important advantage of living in Kerala. That is why when people go abroad, they are coming here because treatment there is very expensive. No, one, not only expensive, very difficult to get also. So that is the biggest challenge of living abroad because health care is very poor in most of the developed countries. They have created an image that everything there is very super, but in reality, our system and our healthcare is far superior to the healthcare system present in any other part of the world. Then, age and gender. Older age is a risk age for many of the lifestyle diseases like osteoporosis. Osteoporosis means bones becomes very weak, so that if you fall, the bones will be having some kind of fracture. So during old age, it is very important that you have to take care of all these things. Then chance of heart disease. All these are more common in most, especially in women. Certain diseases like osteoporosis, heart diseases become more common after the menopause, after an age of 50 or 55. The development of these diseases can increase. Similarly, in case of men, there is a gland known by the name prostate gland, and this is an important nuisance for most of the men because sometimes it can develop cancerous situation. And prostate cancer is a very difficult type of cancer because there are no visible signs. There is a problem with this prostate cancer. Then lack of preventive care, finally, in an infrequent medical checkup, delayed detection of signs can allow conditions like hypertension, diabetes, high cholesterol. These are the three primary troublemakers. Hypertension, if you don't go to a doctor and check your pressure, there is no visible symptom for a high blood pressure. And similarly for diabetes also, unless you check, there is no symptom. And for cholesterol also, there is no symptom. So all these, some people do not go to the doctor and do not take any kind of medical checkup. But what happens is that it should be just like you are taking care of your house. You need to take care of your body. You need to take care of your mind to keep it healthy, fit, and stable. So if you invest proper time and little bit of your money for maintaining your body and mind, then everything will be fine and you can save a lot of money. So one important thing is that nowadays most of the parents are going to be living alone and children will be mostly away. So unless the parents are physically healthy, that is going to affect both the family. Even if you are living somewhere else and you feel that your parents, your father and mother are not very good and you are not unable to take care of them, that creates a lot of tension for you. That is how the Indian system has been. But in a Western country, there is no such a thing. They will be taking care. Even there are some people who thinks that putting our parents in some rest homes is fine. No, all these rest homes are actually money-making industry, and they will just like you. If you send your young kid to a LKG or a play school, when you are getting them, they give them a lot of care, and nobody knows what kind of care actually your children will be getting. The same thing happens in the old age home also. All these are actually money-making industry. There the people never get the proper care. They portray a very fine image. That is the case in India, in Kerala, outside India, everywhere this situation is very weak. So one important thing is that during the time of old age, maintaining having a stable health is very important for the happiness of your life. So these are some of the important things you can keep in your mind while thinking about the lifestyle disease.